I'll share my screen. Right. So I welcome you all again, and today's class is on research in health and social care. So we are going to focus on the importance of research in the field of health and social care and explore the various approaches that are utilized in practice. Um, so we are starting the Unit 5, uh, which is research in health and social care, and we will discuss about the learning outcome 1, which is to understand the role of research and different approaches in health and social care practice. So research is important in driving improvement, ensuring evidence-based practice, and fostering innovation within the sector. So in research, we can say that uh, like and yes, in the meanwhile, if you do have any question, then please don't forget to ask it, and I'll try my best to answer it. Right. So uh, why research is important in health and social care? So research in health and social care is essential for several reasons. First, if we say that it's for improving patient care and outcomes. So example of it could be like through clinical trials, researchers can determine the effectiveness of new treatments for or medication. For example, the development of vaccines involve um research to ensure that they are safe and effective before being administered to the public. And another example could be like studies in social care might explore the impact of different types of counseling on mental health outcomes, helping to refine therapeutic approaches for better efficiency. Then we can say that enhancing evidence-based practice. So research provides a solid foundation of evidence that health and social care professionals can rely upon when making decisions about uh, service user care or a patient care. So, for example, evidence-based guidelines for managing chronic conditions like diabetes involve compiling research findings to recommend best practices for treatment and management. Then we can discuss about policy development and improvement. So, research help shape health and social care policy by providing data on what's work and what does not. Example could be public health research on smoking cessation has led to policies and programs that successfully reduce smoking rates. Then we have different approaches to health and social care research. So to understand the breadth of research in health and social care, it is crucial to recognize the variety of approaches. Each approach has its strength and is suited to different types of inquiries. So, for example, quantitative research. So, this approach involves the systematic investigation of phenomena using numerical data and statistical techniques. It is often associated with measuring variables and quantifying relationship or differences. So, example could be a study examining the correlation between physical activity and cardiovascular health using data collected from large sample sizes to determine statistically significant relationships. Then, if we discuss about the qualitative research, so this approach focuses on understanding individual experiences, behaviors, and social context. So it is more descriptive and interpretive, involving methods like interviews, focus groups, and case studies. An example is conducting in-depth interviews uh, with any service user or patient to understand their experiences and emotional responses to living with chronic pain. Then we have uh, mixed method research as well. So in mixed methods, so combining both quantitative and qualitative approaches to provide a more comprehensive understanding of research, of a research or a research problem. So, for example, uh, example could be a study on the impact of a new public health campaign might use surveys, quantitative surveys, for example, to assess reach and effectiveness, and focus group would be qualitative to gather detailed feedback on public perceptions and experiences. Then we can uh, involve action research as well. So in action research, so uh, in this approach, where researchers and participants, they work together to identify a problem and implement changes and evaluate the outcome. And it is particularly useful in practice-based field. So example would be a project in a care home setting where staff and residents they collaborate to improve dietary practices, observing the outcomes and like uh, outcome and refining the intervention, and also how to improve the service quality. And then uh, if we discuss about uh, there's a longitudinal research as well. So this involves repeated observation of the same variables over long periods, and it is valuable for studying developments and changes over time. An example could be a longitudinal study following children from infancy to adolescence to examine how early life nutrition affects development and health outcomes. Now, if we discuss about implementing research in practice, so understanding different research approaches is just the beginning, and it is equally important to apply these findings effectively in practice. So there are some positive ways to ensure research impacts practice positively. For example, we could discuss about training and development. So continuous professional development ensures that practitioners stay up to date with the latest research finding and methodologies. Then the second one, we can say that integrating research into policy. So uh, it is like ensuring that research findings inform health and social care policies, guidelines, and standards, and standard operating procedures are crucial. Um, Example is incorporating research on infection control practices into hospital policies. Um, why we use them is to reduce hospital-acquired infections. Then we can say that we have collaboration and partnerships. So research involves collaboration between academic institutions, healthcare providers, and policymakers to ensure that studies are relevant and can be translated into practice. So overall, we can say that research is the cornerstone of advocating, or it's like advancing health and social care by understanding different research approaches and their application. So we can improve service user outcomes, inform policy decision, and ensure that our practice is based on solid evidence. So As we continue through this unit, we will explore more detailed examples and we will engage in activities and to strengthen our understanding and application of research in this field. So this is the overall discussion about this unit 5 and the learning outcome number 1. I will move to the next slide. So, okay, in the next slide, we will focus on the components outlined under learning outcome 1 for understanding the role of research in evidence-based health and social care practice. And it involves like how research can develop, improve, or identify gaps in practice, the method used for data collection and analysis, and the potential uses and benefits of research findings. So if we uh, discuss about the role of research in evidence-based practice, so uh, it's like developing, improving, and identifying gaps in practice. So research always play a critical role in developing new policies. How it is done by investigating new treatments, therapies, or interventions. Example is like discovering new drug treatments for conditions like Alzheimer's disease through clinical trials. Then improving existing practices. How we do that is by evaluating current methods and finding ways to enhance them. Example is implementing feedback from service user to improve the process of delivering outpatient care. And what it will do is increasing patient satisfaction and efficiency. Then if we discuss about identifying gaps, so by conducting healthcare audits to discover where current practices might be lacking. um, Example is analyzing patient records to identify areas with high readmission rates and researching why these occur to implement preventive measures. Then uh, we can say that value of research in developing cost-effective intervention. So uh, basically, research helps in cost-effective solutions, and it's like developing intervention that provide the best outcomes with minimal resources. Example is researching different telemedicine approaches to provide cost-effective care to patients in remote areas, reducing the need for physical visits and promoting health and well-being. So um, it's ensuring public health intervention are effective and efficient. Example is like studies on the impact of community-based exercise programs on reducing obesity levels, demonstrating cost savings in healthcare by preventing uh, like we can prevent some diseases. Then we have guidance, protocols, policy, and practice. So in that we can say that we have safety and duty of care. So research establishes the foundation for protocols and guidelines, helping to ensure patient safety and high standards of care. Example is evidence-based guidelines for preventing and managing infections in hospitals. If we discuss about safeguarding, then research informs policies to protect vulnerable populations. Example would be developing protocols for identifying and managing cases of elder abuse in care homes. Then we can discuss about currency of practice. So currency of practice is ensuring that practices are up to date with the latest research. Um, then if we discuss about data collection methods. So we have the types of data analysis approaches. Okay, so if we discuss about the data collection methods, then we have primary data collection. So primary data collection involves directly gathering data through methods like surveys, interviews, and clinical trials. Example is like conducting a survey to understand service user satisfaction after surgery. Then we have secondary data collection. So in secondary data collection, it's like using existing data resources like medical records, databases, and previous research uh, that involves secondary data collection. And example is like analyzing hospital admission data to study trends in seasonal illnesses. And we have discussed about the uh, types of data, like we have quantitative data and we have qualitative data. So if we discuss about quantitative data, then numeric data that can be measured and analyzed statistically, these are in the quantitative data. And if we discuss about the qualitative data, so it's like descriptive data that explores concepts, opinions, or experiences. Then we have analysis approaches. Okay, so in that we can say that we have some uh, statistical packages like softwares. We have SPSS, R, or SAS. Like we use these for analyzing quantitative data. So example is using SPSS to analyze data from a large scale health survey. Then we have grounded theory. So a qualitative research method for developing theories based on data collected. Example is like using grounded theory to understand how service user or patients cope with long-term illness. Then we have uh, validity. So for validity, it's like ensuring that the research measures what it intends to measure. And example is like validating a questionnaire designed to assess patient satisfaction with healthcare services. If we discuss about reliability, so it's ensuring consistent results across different conditions and times. Uh, then we have potential uses or findings in practice. Okay, so uh, draw conclusion from the data, the action that the future research should take, right? So if we discuss about drawing conclusion from data, so we can say that analyzing results. So like to understand the implications and effectiveness of intervention. This is this is the analyzing the results, and the example is like concluding that a new diabetes management programs like will it improve patient outcomes and compliance based on the data collected. Then we have uh, some actionable insights for future researchers. Um, like if we discuss about recommendations, so based on the findings, suggesting areas for improvement or further investigation. Then if we discuss about impact on practice, so uh, for that we can say that outlining how the findings can be incorporated into practice to benefit patients and organizations. And there are benefits to the organization as well. What it does, for example, it enhances practices and it leads to improve patient outcome and policy development. So these all are the important bits. Like research is foundational in advancing health and social care practices. It helps us to continuously develop, improve, and refine our approaches, and it ensures that the care we provide is based on the best available evidence. And if we understand and apply the different methods of data collection and analysis, and by drawing actionable conclusion from research finding, we can significantly um, enhance the quality of care delivered. So I believe these all are the important aspects for this slide. So now our next slide is about the key terminologies. So what is the importance of research in health and social care? Right, okay. So if we discuss about the key terminologies, so research in health and social care involves systematically investigating and studying various aspects of health, illness, and social care practices. Uh, it aims to provide reliable evidence that can be used to make informed decisions about care and treatments. So if we discuss about importance of research in health and social care, so research is important in health and social care for many reasons. Um, by informing and broadening our understanding, it helps us make decisions based on solid evidence. And like now, we will discuss about some important points, uh, like we have informing decision making. So it is important, like research help in gathering accurate information and evidence, which assist professionals in making informed decisions. Then we have diagnosing diseases earlier or more accurately. So in that we can say that research leads to the development of advanced diagnostic tool and techniques. Example is like research into biomarkers can result in earlier detection of disease such as cancers and allowing for timely intervention. Then providing life-changing treatments. So it's by testing and validating new treatments, research provide options that significantly improve patient outcome. Then we have preventing conditions. So uh, in that prevent people from developing conditions. So research help in identifying risk factors and implementing preventive measures to reduce the incidence of diseases. Then improve health and care for generations to come. So uh, what research does is research contributes to the development of long-term health strategies that ensures that better health outcomes for future population. And then we have ensuring better quality of life. So uh, research provides insight into ways to enhance the overall quality of life for individuals, including those with chronic illnesses or disabilities. So, and also uh, we have mm, some key terminologies like evidence-based practice. So, uh, evidence-based practices involve making clinical and care decision based on the best available evidence, and it drive from um, research. And example is like a healthcare provider using recent studies to decide the best practice or the decide the best treatment approach for a patient with, for example, hypertension. Then there are like clinical trials as well. So clinical trials are controlled studies conducted to test the um, safety of new treatments or like its benefits or interventions. Um, so we have discussed all these important aspects. Oh, right. Okay. So now we have to discuss about the definition of research. So um, we can say that research is a process of systematic inquiry that has collection of data, documentation of critical information, and analysis and interpretation of that data or the information. So this process is carried out in accordance with the suitable methodologies set by specific professional fields and academic disciplines. So this is the important aspect, and this is the definition of research. And now we move to the next slide. So now we have to discuss about uh, research skills. Okay, so in research skills, we can say that it refers to the ability to search for, locate, extract, organize, evaluate, or use or present information that is relevant to a particular topic. So some of the like key components of research skills are uh, searching for information. So example is like using academic databases like we have PubMed, Google Scholar, or like we can use the library resources from UK Versity as well, and we can find literature on a specific health issue. For example, like impact of exercise on mental health, or we have like one of the important aspect is locating information. So what do we mean by locating information? Is it's the skill of navigating through various resources to find accurate and relevant information. Then we need to extract the information. So the ability to gather key pieces of information from various sources is extracting the information. Then we need to organize the information. So it's the ability to systematically arrange information for easy access and analysis. Then we have to evaluate the information. So these are like the skills to critically access the credibility, relevance, and quality of the information gathered. Uh, so if we discuss about the importance of research skills in academic and professional context, then academic research is it's a detailed and methodological investigation into a particular area of study, and it involves systematic data collection, analysis, and interpretation to contribute new knowledge or insights to a field. So, an example is like conducting a dissertation study on the impact of social support networks on mental health outcomes in elderly population. So, if we discuss about uh, application in the health and social care, so we can say that developing evidence-based practices, improving patient care, policy making, and continuous professional development, how we can improve the research skills. So, training and workshops, practical experiences, critical thinking, effective writing and communication. So, overall, if we say that research skills are essential for effectively conducting, presenting, and applying research findings, they enable health and social care professionals to make informed decisions, develop evidence-based practices, and contribute to the advancement of their field. So, I believe these all are the important points. Move to the next slide. Right. So we have discussed about the definition of research, and so we have discussed about the definition, characteristics, quantitative research, qualitative research, and we have uh, provided some examples as well. So, move to the next slide. Okay. So now we have to discuss about what are academic research. Right. Um, I was telling you about this in the previous slide as well. Uh, so we have to cover academic research and the essential academic skills. Excuse me. So skills that support successful learning and mastery of educational content. And so if we say that what is academic research again? So academic research is a detailed and methodological investigation into a particular area of study. It involves the systematic collection, analysis, and interpretation of data to contribute new insights or knowledge within a specific field. So, uh, for example, if we discuss about the purpose, so in purpose, we have to discover, to explore new phenomena or find answers to specific questions. Example is like investigating the effects of new training or teaching strategy on student performance. Then we have to confirm the validation. So is like to confirm the validity of existing theories or findings through replication studies, and we have to do literature review. So conducting a comprehensive review of existing research to frame our study in context. Example is like reviewing previous studies on childhood obesity to identify gaps in the research. Then we have to do hypothesis formulation. So it's developing a clear hypothesis or research question based on existing knowledge. Then we have to collect the data. So we can employ uh, qualitative, quantitative, or mixed method approaches to gather relevant data. Then we need to do the data analysis. So it's analyzing the data using statistical or thematic method to draw conclusion. Then we have conclusion and reporting. It's summarizing finding, drawing conclusion, and communicating results through publication or presentation. So why like it's important like in importance of academic skills. So if we discuss about that, so academic skills are crucial tools that help students learn effectively and manage their academic responsibilities. And these skills include study habits, learning strategies, and time management tools. So we have, for example, uh, active learning techniques, we have note-taking skills, we have critical thinking skills, we have time management tools, and if we integrate these skills in lessons, so what it will do is like we have many benefits of academic skills. So overall, if we say that academic research is a systematic and detailed investigation aimed at contributing to a specific field of knowledge and developing strong academic skills such as effective habit of studies, learning strategies, and time management tools. So all these are essential for success in both academic and professional sector. The next slide. Okay. So we have to discuss why is research conducted. So right. So research is like conducted to achieve like numerous objective like which can broadly be categorized into like these areas. Um, Identify potential and new customers. So, what would be the uh, purpose of it? So, it's like to expand the customer base by understanding potential market segments and identifying unmet needs. Uh, Example is like a company might conduct market research to identify demographic groups that are not currently using their products but could benefit from them. For example, a tech company might research potential users for a new app, and it could be aimed at senior citizens. Then understanding existing customer. So uh, in that we can say that why we do that is to gain insight into the preferences, behavior, and satisfaction levels of current customer, and it helps to improve products and services. Then set pragmatic goals. So the purpose of this is to establish realistic and achievable goals based on data and insights. Then develop product market strategies. So the purpose is to create effective marketing and sales strategies based on data driven insight. Then uh, address business challenges. Okay, so the purpose is to understand and find solutions to specific business problem. Then we have to put together a business expansion plan. So it's like to gather information necessary for planning and executing business growth and expansion. Then identify new business opportunities. So it's like to uncover potential new areas for growth and innovation. Uh, Example is like if we do a market research that might reveal a gap in market for eco-friendly products, promoting a company to develop a new line of goods. Like for example, a fashion brand could discover a growing demand for ethically sourced clothing and create a new collection to meet this demand. So these all are the important points. And we have types of research, which we have discussed. We have the research methods. So we already discussed about uh, the quantitative and qualitative data, and we also discuss about mixed method. So okay, so we have to discuss about these. Okay, so we'll go through with it again. So now we have qualitative methods. Okay, so uh, for qualitative research, we can say that, qualitative research is a methodology that focuses on exploring participant perspective, experiences, and behaviors in depth. So this approach prioritizes understanding the context and meaning behind the data collected rather than numerical measurement. Uh, so it's basically like, to make it easy, if we talk about qualitative, so it comes from quality. So if we discuss about any quality, then we will have to express in feelings, emotions, or verbal or non-verbal communication, things like that. So it's in uh, it's a quality. So we will write more about it to make it easier for you. And there are like some types of qualitative methods. It's we have one-to-one interview. So in one-to-one interviews, researcher engaged with participant individually and asking open-ended questions to gather into their thoughts and feelings and experiences. And then we have focus groups. So for focus groups involve bringing together a small group of participants to discuss a specific topic, guided by a moderator. And participants interact with each other, sharing their opinions and experiences. Then we have ethnographic studies. So, ethnographic studies involve immersing the researcher in the natural setting of the participant to observe behaviors, interactions, and cultural practices. Then we have text analysis. So, text analysis involves analyzing written or verbal text. Examples are interviews, document speeches to uncover themes, patterns, and their meanings. Then we have case study. So, okay, so in case studies like involves a detailed examination of a single entity or a small number of subjects to investigate complex phenomena within a specific context. Um, then, if we say that some of the characteristics of qualitative research methods. So we have open-ended questions, and we have subjective interpretation. We have rich descriptive data. We have flexibility. We have participant-centered approach in qualitative research. Mm, some of the practical applications involve like healthcare, education, social sciences, market research. These all are some of the practical applications related with the qualitative method. We move to the next slide. Now we have to discuss about the quantitative methods. So, uh, quantitative research involves the systematic collection and analysis of numerical data to answer research questions scientifically. And this approach aims to quantify phenomena, establish relationship between variables, and draw statistical uh, inferences for explanation, prediction, or control. So in easy words, we can say that it's quantity. It comes from quantity. So it says that quantitative. So wherever we discuss about quantity or quantitative, so it has some numeric representation. So it's like it will be easier to understand that when we talk about in easy words, we can say that when we talk about uh, quantitative data or quantitative research, so we will have numbers. And if we discuss about qualitative data, so then we have um, the data in quality, in expression, and as we discussed earlier. So now we discuss about the quantitative research. So now we have to discuss about types of quantitative methods, and these include survey research. So what is survey research? Survey research involves collecting data from a sample of participants using standardized questionnaires or structured interviews. Then we have descriptive research. So descriptive research focuses on describing characteristics or behaviors within a population, providing a snapshot or of a phenomenon or at a specific point in time. Then we have correlation research. So it's examines the relationship uh, between two or more variables, and it's to determine how they are related and to what extent they change together. Then we have, if we discuss about some of the characteristics of quantitative research method, so we have numerical data, statistical analysis, and we have objective measurement, hypothesis testing. If we discuss about the practical application, so we use that in health sciences, business and marketing, education, and social sciences. Uh, uh, these all are the important aspects. We'll move to the next slide. Then we have uh, quantitative methods, right? So we have to discuss. It is essential to ensure that your data is valid, accurate, reliable. So, okay, if we discuss about some of the key aspects, then if we talk about validation, so like data validity refers to the extent to which the data accurately represent the concept being studied, and its importance is ensuring that the data collected is founded on sound research principles, logical, or and it should be like impartial. Then we have accurate. So accuracy in data refers to the freedom from errors and ensuring that all necessary details are included. Um, then we have reliable. Right. So reliability indicates the consistency and dependability of data. And if other researchers use the same method, they should produce similar results. Then we have timely. So timeliness in data collection, it signifies that data is current and collected within an appropriate time frame. Then we have complete. So data completeness include or like it indicates that all necessary information and variables are present to support the research and business decision. Then we we have all these aspects. Then move to the next slide. Right. So here they are discussing about 8 tips for conducting accurate research. So it says that identify the main trends and issues and opportunities and problems you observe. Uh, Write a sentence describing each one. Then we have keep track of how often each of the main finding appear. Right. So we have some of 8 tips are mentioned in that slide. Uh, and we can include like some more points if we want, like we can define our research question clearly. Then few tips are we can establish a research plan, and we need to use reliable and credible sources. So we need to make sure that we gather information from reputable sources, and for example, like peer-reviewed journals, academic publication, and government report. And we need to ensure that the sources we use are current and reliable. Then we can say that we need to use a systematic approach, and by following a systematic approach to data collection and analysis, uh, we need to organize our data effectively, use appropriate methodologies, and maintain consistency in our research. Then we need to avoid biases, and we need to be mindful that may affect our research finding, and we need to stay objective, consider different perspective, and avoid skewing result based on preconceived notions or preferences. So these all are few of the important aspects. Someone mic is on. Thank you. Right. So now we have what is research in health and social care. So research in health and social care plays a vital role in advancing our understanding of health-related issues and social welfare, and it ultimately leading to improvements in treatment policies and care practices. So few of the important aspects are we discuss about evidence-based practice, and we discuss about improving patient outcomes. Then we have policy development, we have preventive health measures, and we have innovation and progress. Then we have health equity and access. Uh, we have profession development. We have community and public health. So research in health and social care is a dynamic and multifaceted field that drives progress, innovation, and positive change in health practices and policy making and service delivery. By conducting impactful research, we can address complex health challenges, improve service user outcome, and promote well-being on a broad level. Then to the next slide. So what is health and care research? So health and care research, in that we can say that Health and care research is a fundamental endeavor that aims to enhance our understanding of healthcare practices, treatment, policies, and social welfare strategies. It plays a pivotal role in guiding decision-making processes, driving improvements, and fostering advancement in the field of health and social care. So we have uh, diagnose disease earlier or more accurately, provide life-changing treatments. Right. So we have these important aspects if we discuss about informed decision making, then healthcare research provide uh, evidence-based insight that inform decision making process in healthcare setting. Then, if we discuss about advancing medical knowledge, so research in health and care really leads to discovery of new treatment, diagnostic method, and preventive measures. If we discuss about early diagnosis and treatment, then by diagnosing diseases earlier or more accurately through research finding, um, healthcare providers can implement timely intervention, improve patient uh, um, prognosis, and enhance the treatment efficacy. Then we have preventive healthcare is health and care research focuses on preventive measures to reduce the incidence of diseases and promote overall well-being. So these all are the important aspects. And we have what is an example of research in healthcare. Okay, so we have to discuss about clinical research, right? So that's for, okay. So clinical research, like it includes clinical trials, and it plays a critical role in advancing healthcare by evaluating new treatments, medicines, and diagnostic tools. So we have some examples. Mm, So, like developing a new test for breast cancer. Okay, so research studies focus on developing innovative diagnostic tests for breast cancer, or it aims to improve early detection, accuracy, and precision in diagnosing this prevalent condition. And clinical trials may evaluate the effectiveness, reliability, and feasibility of new diagnostic technologies such as imaging techniques, genetic testing, or biomarker analysis for breast cancer detection. Then we have comparing two medicines to treat heart disease to see which one works better. Okay, so for that we can say that clinical trials comparing two medication for heart disease involve rigorous research methodologies to assess the efficacy, safety, and outcome associated with each treatment option. And these studies aim to determine which medication is more effective in managing heart disease, reducing symptoms, preventing complication, and improving overall patient outcome. So these are the important aspects. So in this one, uh, we have how research contributes to our NHS, and we have a short film here. Click on the link.
Research. There's something for everyone. There are many different ways to take part in health and care research. Physical tests, questionnaires, lifestyle changes, donating samples, drug trials, scans. When you volunteer, you might be invited to complete a questionnaire in person or online. Be part of a focus group where you can give your opinion or provide feedback. Take part in a lifestyle activity, such as filling in a diary or doing something physical. You might be asked to have a scan, donate a sample, or take some medication. What you can do will depend on whether you're eligible to take part, but also how much free time you have and how confident and comfortable you feel. There are also opportunities for you to have a say in what research is funded and how it is carried out. Be part of something amazing. Be part of research.
Right. So we have this video. After that, what we have? We have another video to watch.
Hey you! It's time for a holiday.
Folklore and speculation, and for centuries before that on little more than magic and superstition. Our forebears had many questions, but they didn't have the hard evidence that allowed them to answer them, and in turn to make good decisions for their patients. Without clinical research, healthcare is in some ways a guessing game. Of course, with experience, practitioners can learn through trial and error which treatment might be most appropriate, but surely there is a better way. And as well as looking backwards, why not imagine a future where there is no more research? What would medical care be like there? Again, this is an easy thing to imagine, for if clinical research were to stop today, the healthcare of the future would be exactly as it is today. No new treatments, no new ways of alleviating pain or suffering, no new ways to prevent disease. Healthcare would in effect be frozen in time, for it's only through the discovery associated with clinical research that we move forward. Although medical care in the 21st century is remarkable, especially if we compare it even to the recent past, I think we all realise that it isn't perfect. There are still conditions that cause great suffering. There are still diseases that we struggle to treat effectively, and some of the treatments we do use may cause unpleasant or unacceptable side effects. We all want healthcare to progress and improve, both for ourselves and for the next generations. Clinical research is the engine that will drive that progress forward.
Right. Then move to the next slide. So now here we have the references. So we can conclude it like research plays a pivotal role in various fields, including health and social care, and by providing evidence-based insight, driving innovation and informing decision-making process, um, like whether we use qualitative or quantitative research. And what we do is we get the knowledge through a systematic inquiry that leads to advancement in treatment policies and overall care by practices. And if we uphold practices of validity, accuracy, reliability, uh, and completeness, so researcher can ensure that integrity and trustworthiness of their finding. And research is a dynamic and essential tool that contributes to progress, improvement, and positive change in health and social care and beyond. So these all are the important aspects for today's lecture. And this was related with the Unit 5, and I'll see you tomorrow again. And till then, take care. Bye, everyone. I'll stop the recording first.